One thing every person should know is how to perform CPR. I have been CPR certified for over 10 years. I work at a dental office, and the doctor that I work with makes it mandatory that all of his employees are CPR certified, trained, and understand how to actually perform CPR. CPR is cardiopulmonary resuscitation. CPR is a life-saving technique used in many emergencies such as heart attack or drowning. Even untrained bystanders can help perform CPR. For an untrained person, there are still options for performing CPR that is recommended by the American Heart Association. This is to do chest compressions only for a rate of 100 compressions per minute. Doing something is always better than nothing. In any emergency, the number one thing to do is to call 911 immediately. Then CPR procedures can begin. CPR has had many changes throughout the years, so it is essential to keep up on your training. If the need arises to perform CPR, the American Heart Association wants you to remember one word, CAB. C-A-B, which stands for circulation, airway, and breathing. I'm going to ask one of my audience members if he can come up and help me demonstrate some CPR procedures. Trevor, could you come up? Now, if you could just lay on the floor right here in front of me. Okay, the first person is to make sure that the first thing to do is to make sure that the person is on their back and they're on a firm surface. And then you're going to kneel down beside them with at their neck and shoulders. To perform the chest compressions, you're going to take the heel of your hand and put it in the middle of their chest. You'll take your other hand and place it on top and interlock your fingers. You would do 30 chest compressions at this point. You want to make sure that your shoulders and your elbows are locked and your shoulders are over top of your hands when performing this, so you can put all of your body weight into it. You're actually going to go down into the chest about 2 inches when performing CPR. You're going to do 30 chest compressions of that. And then next is to make sure that their airway is open. To make sure their airway is open, you will put your hand on the palm of on their forehead and lift their chin up. If the person is not breathing at this point, this is when you're going to perform your mouth-to-mouth, which takes us to the breathing techniques. With the airway open, pinch the nostrils, and you will put your mouth around theirs to perform a seal. You give 2 rescue breaths. During the first rescue breath, you're going to check and make sure their chest is rising. If their chest is rising, then you will go ahead and give the second breath. If it's not rising, then you will do the head tilt chin maneuver again, and then give the second breath. You repeat the chest compressions and breathing until help arrives. The chest compressions, the head tilt, chin maneuver, and the breathing is 1 cycle. You will perform 5 cycles of this until your help arrives. Using CPR on a child would be the same steps, except for a child you would only use 1 hand and your breathing would be less, more gentle. So your chest compressions are going to be more gentle and the breathing technique is going to be more gentle. Thank you, Trevor, for assisting me. You can go sit back down. Now to sum up the CPR. It's always knowing the importance of being trained to save a life. Remember the CAB, C-A-B, circulation, airway, and breathing. So 30 chest compressions, head tilt and chin maneuver, and 2 rescue breaths while monitoring chest rising. You repeat this cycle 5 times until your help arrives. Thank you.